According to the Centers for Disease Control, over 28 million Americans suffer from sinusitis. We just shared with you some information that may help you relieve some of those conditions, but for many, medications may not be enough. The specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery want you to know about another option to surgery. It's a minimally invasive procedure called balloon sinuplasty, and it just may be your answer to chronic sinusitis.
Balloon sinuplasty is a procedure that was developed about 7 or 8 years ago to open the sinuses in a minimally invasive way by placing a balloon into the openings of the sinuses, inflating the balloon much as we would an angioplasty of a blood vessel that gently opens the sinuses by fracturing the bones to provide a wider passageway for the sinuses to ventilate and drain properly. So balloon sinuplasty is indicated in somebody who has chronic sinus symptoms, who has some degree of sinus infection or narrowing of the sinus openings on a CAT scan, and who don't respond satisfactorily to medications. With traditional sinus surgery, we go into the nose, we go into the sinuses, and we're removing infected tissue. With a balloon procedure, we're able to place a balloon up into the sinus opening and inflate it, which allows the sinus to be fractured open, so to speak, and it keeps it open. And what's interesting about the balloon procedure, the downtime is a lot less. We're not removing tissue. The chances for complications and problems after the surgery are a lot less. And most importantly, the patients can return to their normal activities much more quickly. The symptoms that would lead us to believe that somebody would be a candidate for any kind of sinus procedure would be somebody who hasn't responded to aggressive medication, somebody who's having symptoms such as facial pressure, stuffiness, heavy sinus drainage, chronic cough, more than they think that they should, whether it's 2 or 3 times a year or one particular episode that just doesn't seem to ever get better. The balloon sinus dilation procedure can be done in the office as a standalone procedure, or it can be done in surgery in conjunction with other surgeries that we do at the same time, whether it be a deviated septum operation or something else that we do.
For more information on this story, as well as links to the specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the balloon sinuplasty story link on our homepage at yourhometownhealth.com.